Hello everyone, it's Angelika Kargulewicz, clinical nutritionist, and in today's episode we will talk about oils, which oil to choose and which oil has the best influence on our body. Fat in everyone's diet is a key nutrient. I probably don't have reminding, but why? Because they provide valuable fatty acids, especially the unsaturated ones, and of particular importance, especially for young children and for the seniors, so-called EPA and DHA, which is eicosapentaenoic and docosahexaenoic acids. These particular omega-3 fatty acids, EPA and DHA, they build up the membranes of the brain cells, and it is precisely these fatty acids which constitute a valuable component with so-called neuroprotective effects. In the central nervous system, it is fats that make up 50 to 60% of the brain's dry weight, and fats are also essential for the production of important molecules, for example like adipokines, and here we can talk about leptin that regulates our appetite, but also about adiponectin, which determines, among other things, insulin sensitivity. But it is worth emphasizing that it is not about any fats, but mainly about so-called essential fatty acids. These fatty acids build also neurotransmitters, which are transmitters that transport important information in our body, directly affecting our brain function, but also our emotional behavior, and they also regulate our immunity. Docosahexaenoic acid is also important for protecting vision. As the results of the study show, people consuming at least 64 mg of docosahexaenoic acid per day had a lower risk of macular degeneration than those consuming less than 26 mg of this omega-3 fatty acid per day. Another study documented that a daily dose of 800 mg of docosahexaenoic acid for both 2 and 4 months increased macular pigment optical density, which is a marker of retinal health, and very similar relationships were observed for another long-chain omega-3 fatty acid, EPA. Consumption of at least one portion of cooked or baked fish per week and optimally 2 portions of oily fish is associated with a reduced risk of macular degeneration. We often wonder which oil to choose, asking ourselves, for example, which oil contains aforementioned EPA and DHA fatty acids, and for example, which oil is recommended as a salad topping, like a regular addition to a daily diet, and for example, which oil is more therapeutic and should be used only in small doses. Cod liver oil, what is it? It is a fish oil. Sometimes it is colloquial to lump omega-3 fatty acids together and think that, for example, camelina or flaxseed oil has the same properties as, for example, cod liver oil. I even remember the case of 2 seniors arguing who did better. One of them ate a spoonful of cod liver oil per day and the other ate a spoonful of flaxseed oil. While vegetable oils, like for example flaxseed oil, offer health benefits, they are not a significant source of omega-3 fatty acids like eicosapentaenoic and docosahexaenoic acids, which are important and crucial for the neuroprotection. Vegetable oils primarily contain alpha-linolenic acid, which is another type of omega-3 fatty acids. However, human body's ability to convert alpha-linolenic acid into EPA and DHA acids is limited. Therefore, to obtain bioactive and long-chain docosahexaenoic fatty acid, we should consume fish, particularly cod liver oil, which is especially rich in DHA. Important effects of cod liver oil with a high dose of EPA and DHA is the property to lower the blood pressure, so-called hypotensive properties. And it is also important to remember that cod liver oil can lower the triglycerides levels. It also possesses anti-inflammatory and antithrombotic properties. Fish oil is also beneficial in managing multiple sclerosis because eicosapentaenoic acid supports the repair of the nerve sheaths damaged by the disease through a process known as remyelination. Studies indicate that omega-3 fatty acids, including EPA, may promote remyelination after central nervous system injury. Additionally, omega-3 fatty acid supplementation has been also associated with improved quality of life of people with multiple sclerosis, attributed to its positive effects on inflammatory markers and also reduction rate of relapse. And it is also advisable to choose a high-quality cod liver oil which contains at least 1000 milligrams of EPA and DHA, and preferably 2000 milligrams of these omega-3 fatty acids. And what about shark liver oil, such as Greenlandic, New Zealand or Tasmanian one? Definitely a different composition to cod liver oil. Shark liver oil is low in EPA and DHA but contains alkylglycerols which possess the ability to accumulate in the membrane of the bacterial and cancer cells while damaging them. They also improve the function of the immune system and are used in psoriasis and arthritis. And another desirable ingredient of the shark liver oil is squalene, which possesses anti-age properties. Other indications for use of shark liver oil are cardiovascular disease, including hypertriglyceridemia, but here I would definitely put more weight on cod liver oil. Another interesting, but this time plant oil, is linseed or flaxseed oil. It is a very valuable oil, but it contains neither EPA nor DHA acids. It is distinguished by its particularly high content of another omega-3 fatty acids, alpha-linolenic acids, up to 60% of its composition. It can be used externally because it accelerates the regeneration of the skin and mucous membranes, while its internal use is mainly the prevention and support of atherosclerosis, so mainly the prevention of cardiovascular disease. For some, it has a rather pronounced, not necessarily acceptable taste. Instead, you can try camelina oil as an alternative. It has a nutty and onion flavor and possesses similar health benefits to linseed oil. You can use it as an addition to a salad or, for example, to a paste based on legumes, and it will definitely increase the absorption of fat-soluble vitamins like A, D, E, K, but remember, never fry on it. Another beneficial oil is pumpkin seed oil. As well as having a pleasant nut-like taste, it is also characterized by unique properties. First of all, it contains unsaturated fatty acids, even 78% of its composition. It provides anti-aging squalene and valuable phytosterols, mainly stigmasterol, which regulate lipidogram. It also provides some selenium and possesses anti-inflammatory and anti-edematous effects. Due to its phytosterol content, it is particularly recommended for men with prostate hypertrophy and impaired urination, both as a supportive and also preventative measure. It is also recommended in lipid profile disorders. It is worth bearing in mind that pumpkin seeds show similar effects, and coming back to pumpkin seed oil, you can use it in the salad, on the bread, but remember, never fry on it. Another interesting oil is a sea buckthorn oil. It is pressed from the ripe seeds and fruits of the sea buckthorn. It is useful as a healing agent in lesions of the skin and mucous membranes, and internally in supporting the treatment of gastric, duodenal and large intestine ulcers. It should be used in small quantities as a dietary supplement and, of course, never fry on it. And another recommended oils are evening primrose oil and borage oil. They have a unique composition, mainly due to the presence of gamma-linolenic acid, which has health-supporting properties like anti-inflammatory, antioxidative, because they act like a free radical scavenger, but also anti-cancer and lipid profile regulating properties, which means that these oils can be used like a prevention of the cardiovascular disease. Evening primrose and borage oil are also indicated in hormonal disorders like premenstrual syndrome or increased breast pain, but also in diabetes and improvement of the skin, and also in the protection of the body against viral and bacterial infections. It is also recommended in the course of multiple sclerosis because it improves people's well-being, and also in rheumatoid arthritis. We should remember that prolonged use of borage oil or primrose oil may cause excessive blood pressure lowering and laxative effect, so it is recommended to use it no longer than 4 months. And when we use it, we should use only small quantities as a dietary supplement, and we should never fry on it. In conclusion, oils are extremely valuable but also susceptible to rancidity, especially when exposed to oxygen, light or temperature fluctuations. So in order to maintain their quality, store them in a small dark glass bottles in a dark and cool places to minimize oxidation. Refrigeration can further extend their shelf life. And regarding omega-3 fatty acids, especially long-chain bioactive types like EPA and DHA, they are predominantly found in animal sources like fish oil, particularly cod liver oil. In contrast, plant oils provide other unsaturated fatty acids, and additionally be mindful of the calorie content because 1 tablespoon of oils provides approximately 120 calories. Thank you very much for watching my video. If you like it, please leave the thumb up, subscribe the channel, and see you soon in the next episode.